Ang haba ng part 1. Okay, part 2. Okay. So, let's start with the innate immunity. Ba't siya tinawag na innate immunity? Innate within. So, meron ka ng immune system pagkapanganak mo pa lang. Kaya ginagawa mo doon, pinapalakas mo na lang siya. Okay? So, what happens if you caught a virus or an infection? So, let's say, gumagalaw ang virus. Okay? So, anong nangyari sa'yo? You caught a virus. You caught an infection. Okay? Anong gagawin ng katawan mo? Okay? So, the innate immunity is a non-specific immunity that will react to a pathogen that entered your body. So, ang gagawin niya, atake lang niya, release all the defenses that it can do just to stop the infection. Okay? So, ang characteristic niya, non-specific. So, anong possible na mangyari? You can have a fever, you can have mucus production, meron kang umubo, mangangate, magkakaroon ka ng inflammation, but it might not kill the pathogen. It might not solve the problem efficiently. Kasi, ang gagawin lang niya, launch the immune response kahit hindi alam kung anong klaseng pathogen ang umatake. Okay, so, ayun lang yung innate immunity. Minana natin sila sa ating mga magulang. It is non-specific. Okay? So, it's not specific. Next, we have inflammation. Release of histamines causes inflammation. So, it can be the pathogen. The pathogen might contain histamine, or let's say your cell releases histamines. Let's say meron siyang adverse reaction to a substance that you ate, that a substance you inhaled. So, magre-release ng histamine yung body natin. Bakit nagkaroon ng inflammation? Because there will be dilation and increased permeability of blood vessels due to the release of prostaglandins. So, ano nangyayari dito? When your blood vessels dilate, lalaki ngayon yung volume niya. It will allow entrance of blood into it. Paano nag-increase yung permeability? I will show it to you later after this slide. The dilation and increased permeability of blood vessels due to the prostaglandin will allow increased blood flow. Histamines activate prostaglandins. Prostaglandins will allow increased blood flow. After nun, usually, kapag nagkakaroon ng inflammation, di ba, mainit? Bakit siya mainit? Because there is too much blood vessels. And then, there will also be release ng pyrogens dun sa area na yon. So, nangyayari redness kasi sobrang daming dugo, and then swelling. Kasi, yung nga, nagkakaroon ng dilation ng blood vessels. Dumami yung substance na naging present dun sa area na yon, kaya siya nagsaswell. And afterwards, iinit yon because of presence of pyrogens. So, paano siya nagwo-work? So, let's say, nasugatan ka. So, nasugatan ka, may pumasok na mga bacteria. Yung mga bacteria na yan, magre-release ng histamines. Ito yung mga histamines. And then, because of the histamines, let's say may blood dito, magkakaroon ng release of prostaglandins. Pagka na-release yung prostaglandins, the postcapillary sphincter will close, the precapillary sphincter will open. So, compare nyo yung diameter nito sa diameter nito, ang laki ng difference. So, anong nangyayari is that na-stuck ang mga blood dito. Gusto mong ma-stuck yung blood kasi you want to prevent the bacteria from moving. So, let's say pumunta dito. Gusto mo, let's say pumunta lang dito. Pero dahil maraming dumarating na white blood cells, let's say meron pa mga granulocytes dyan, there's a chance na kakainin yung mga bacteria na yan, kakainin yung mga histamines na yan. So, sabi kanina, there is increased permeability of blood vessels due to the prostaglandins. Bakit? Ano ulit ginawa ng prostaglandins? Sinarado niya yung postcapillary sphincter. Nung sumara yun, naipon na dito. So, anong nangyari? Para siyang lobo na lumaki yung volume. So, kapag lumalaki yung volume ng lobo natin na may butas, lalaki rin yung butas na yan. Sabihin nyo, sir, saan ang galing yung butas? If you can remember the intercellular cleft found in your capillaries, yan, siya yung lumalaki. Kung lumaki yung butas, lumaki yung intercellular cleft, what happens to permeability? Siyempre, permeability of the blood vessels increases. So, increase. So, gagawin ng white blood cells, makakalabas sila. And now they can eat the pathogens. And afterwards, makakalabas yung mga platelets nyo. And then, magkakaroon ng blood clotting reaction. Or magkakaroon ng blood clot. So, please remember how blood clot works. Okay? So, the phagocytic cells, the neutrophils are the first to arrive. They are suicidal in nature. They will eat the let's say bacteria, the pathogen, and afterwards they will explode. Okay lang na mag-explode sila. Pag nag-explode sila, wasak na naman yung mga pathogen. Destroyed na yung mga pathogens. And then, darating yung mga macrophages. They will clean up after the neutrophils. It will eat the neutrophils na nasira. It will eat the pathogen na na-release nung pagsabog ng neutrophils. Okay? So, I have discussed this earlier. Okay? So, severe infection. Fever is an immune response to severe infection. Example is sepsis. So, kailan nangyayari sepsis? Let's say, nagkasugat ka, merong pumasok na tetanus, may pumasok na pathogen na magkakos ng severe infection. One good example is sepsis sa paggamit ng tampon sa ng babae. So, you have shock there, and then or septic shock dun sa pag yung baby pinanganak tapos hindi nalinis yung rectum ni mommy. So nung dineliver si baby, may dineliver nakakambal si baby, which is the feces of the mother, and then let's say napunta sa blood ni baby yung some bacteria from the feces, there's a chance na magkaroon ng severe infection or sepsis. Can be caused by pathogen, maybe due to pyrogens released by some leukocyte, can facilitate phagocytosis. Yun ang effect ng fever. Ano nangyari sa septic shock? Let's say, karoon kang pumasok nga dun sa blood mo yung bacteria. Okay? So, let's say, Pseudomonas, kunyari lang, aeruginosa. Magkakaroon ka ng high fever. Because of high fever, yan, gagawin mo yung action mo sa pathogen, denature mo, okay? So, allow phagocytosis ng bacteria. Pero dahil sa sobrang taas ng fever mo, ang mangyayari is that it can also destroy proteins found in the cell membrane of your cells. So, ano mangyayari? Masisira yung mga cells mo. It can affect your heart. It can affect your vital organs. So, it can cause death to you. Ano pa? It can cause hypotension. Bakit? Kasi mast cells will be released. Kapag na-release yung mast cells, magkakaroon ng inflammation, and this inflammation can lead to hypotension or low blood pressure. So, kaya kayo wag nyong aalaw na magkaroon ng infection. Pag nagkaroon kayo ng wound, linisin nyo agad. Okay? Kasi it can cause sepsis. Okay, so that will be the second part.